The following is a paid program and does not necessarily represent the views of MyTV Baltimore.
Hi, welcome to Straight Talk. Today we're going to be talking about a lot of different health issues, especially for women. And we're going to be talking with some experts and some people, survivors of cancer, will be joining us. So it's a really informative show. So hopefully you got your pencil and paper ready to find out where to get some help and some service. And we're going to start with an issue that they call below the belt cancers. And it's for women. And joining me is Dr. Sarah Temkin from the Johns Hopkins Kelly, make sure I get it right, Gynecologic Oncology Service.
You
Right?
said it perfectly.
Is that right?
Yeah.
Oh, good.
That was great.
Good. That sounds like
It's a mouthful.
It is, but I'm sure you do amazing work, and we're going to hear about it. So welcome to the show.
Thank you for having me.
Let's talk about below the belt cancers. Obviously, I think we know what that is, but why don't you, what are some of those cancers that we're talking about?
So what we're referring when we talk about below the belt cancers are cancers that affect women that are women and not men that are not breast cancer. So the three main types of cancer that we take care of as gynecologic oncologists include ovarian cancer, cancers of the uterus, and cervical cancer. And these cancers affect about 100,000 women per year in the United States.
Wow, and you're at Johns Hopkins, so you probably get patients from all over the United States.
Yeah, and all over the world.
Yeah, that's amazing. It's hard to list which one's more, which one's worse than the other, or which one's more common than the other. What do you see the most?
So endometrial cancer or cancers of the inside lining of the uterus are the most common cancer that we see, and those affect over 50,000 women per year in the United States. And these cancers are linked to obesity and also become more common as women get older, so we see those very frequently. And then women with ovarian cancer have a more difficult course because these cancers tend to be more aggressive and caught at later stages, so the treatment is much more complex.
Now, are all these treatable?
So everything is, yeah, we do try to treat every patient that we see with the most advanced treatment that we have available.
And the success rate is varies depending on how severe the cancer is?
Yeah, and so some cancers are more treatable than others. The cancers of the uterus that I was just talking about tend to be caught early and tend to be low stage and low grade, and so women tend to do very well with those.
Yeah. What are some of the symptoms? What should women look for to be concerned?
So we want women to pay attention to their bodies and talk to their doctor if they have anything that feels abnormal to them. Bleeding after you've reached your menopause is absolutely not normal and is one of the things that we worry about a lot. Some of the other cancers have more vague symptoms that they present with. Ovarian cancer typically presents with very subtle symptoms such as changes in your bowel habits or bloating that are very common, and so can lead to delays in diagnoses. And
so for a woman, I mean, is it recommended that women be checked every year when you reach a certain age?
Right. So having a physician that you have a good relationship with is going to be very important, and also letting that doctor know when something feels different in your body and paying attention to that. Even sometimes I tell people, you could keep a diary of what's happening every day just so that you're very mindful of what's happening and you can communicate it well to your provider.
How about hereditary issues? Are any of these, I mean, we know with breast cancer we see a lot of hereditary in there. What about ovarian and other cancers?
I feel like when I talk to patients, I say 100 times a day, like, we know more about genetics every single day, and the the knowledge that we have about genes and the relationship between familial patterns and cancer has changed dramatically over the last several years. So we know that ovarian cancer is typically linked to the BRCA genes, but there are a number of other gene mutations that can be passed through a family as well, and not necessarily from the mother's side only. Cancers of the uterus tend to be linked with family histories of colon cancer as well. So paying attention to your family history is something that your physician should do and help you to think about.
Yeah, I would think that that's a big part.
Right.
One of the first questions, little family history of what your parents or grandparents, does it go that far back?
Yeah, exactly. And you know, we refer for example, we refer all of our patients with ovarian cancer for genetics counseling.
Okay.
Every single patient with ovarian cancer should be tested for the genes that are most commonly associated with ovarian cancer. And so in genetics counseling, typically there'll be a multi-generational family tree that's created in order to really get an in-depth view of what your risk factors are.
So your biggest message here is to check with your doctor. If you know, make sure you see a physician on a regular basis, certainly as you're getting older.
Right, and our cancers, or the cancers of the female genital tract, really are mostly diseases of older women. Except for cervical cancer, which it's important still to get your pap smear.
Right. Well, thank you for getting us started here.
Yeah.
You know, we're going to continue talking with a patient, a survivor of ovarian cancer, and we're going to hear her story. So thank you very much.
Thank you.
When we come back to Straight Talk, we're going to continue talking about women's issues, health issues. Stay with us. We're coming right back.
I just need a second.
Is your weight holding you back? Are everyday tasks getting harder and harder to do?
Did you see this? Your cousin's in the hospital from a heart attack.
Really?
Health risks associated with excess weight or obesity can be serious. But you can do something about it.
I know you're worried. I found this.
Take the Your Weight Matters Challenge. Visit yourweightmatters.org, where you'll find free resources to help you take control. You can start improving your life right away. Download the free toolkit to prepare you to speak with a healthcare provider about your weight and health. Your weight does matter. Accept the challenge and take charge today. Visit yourweightmatters.org.
I had my career path all planned out while I was on a combat patrol in Baqaba, Iraq. A rocket propelled grenade took my arm off at the shoulder. When I came home, I felt alone. My family was around me, but I couldn't talk to them about what I'd seen and what I'd done. I remember just thinking, man, the way I am right now, I don't want to live. I was discharged from the Army, and I've been working with the Wounded Warrior Project since 2007. Warriors don't have to be severely wounded to be with the Wounded Warrior Project. We do have a lot of guys that have post-traumatic stress disorder. Being able to share your story, I guess it kind of helps you wrap your mind around what did happen over there. Just because you've left the military doesn't mean your life is over. Because when these guys are coming home, I'm kind of leading and training them. Instead of for combat, I'm leading and training them to heal. If I come away with anything from Wounded Warrior Project, it's them giving my life back. My name is Norby, and yes, I do suffer from post-traumatic stress disorder, but I'm okay.
Straight Talk. We're talking about below the belt cancers for women. Ovarian cancer is one of those that is a very common cancer that we see. And we're talking with Rosie Brilliant, who is a ovarian cancer survivor. And welcome to the show.
Thank you. Thank you for having me.
Dr. Temkin is going to join us. Stay with us. Thank you for joining us on this segment as well. Rosie, tell me a little bit about your story.
My story started actually probably 50 years ago. Okay, my mom died just after my husband and I got married. And at that time, she was diagnosed with colon cancer. I always feared that, and her mother had passed away at a young age. She was 53. And so, and at that time when my grandmother passed away, the technology wasn't what it is today, and they had no idea. They called it woman's cancer, for lack of anything better. So I was always concerned that, you know, it was something genetic and it was going to get passed on to me. And you know, I guess the thing that upsets me the most and that I would want to tell most women is that, you know, I am an ovarian cancer survivor, and as Dr. Tompkins said, you need to know your own body. And I think you also need to question your doctors and don't be afraid to. But as I said, my story starts way back. But in the recent past, when I was finally diagnosed with cancer, I was walking in my development, developed a pain in my thigh, went to the orthopedist. He sent me for a CAT scan. When the CAT scan came back, it showed that I had cancer, and he didn't even know how to tell me. I mean, that was like from out of the blue. Right. I then proceeded to talk to more doctors and find out, you know, what was going on. The long and the short of it was they were 85% conclusive that I had ovarian cancer. But being the person that I am, I wanted to be sure it was really that. 85 wasn't enough. I wanted to hear 100.
I don't blame you.
Okay, you know, and so I then proceeded to visit 3 different surgeons here in Baltimore, 2 of which turned me away and said there was no reason to do surgery on me. Well, I feel like as a woman, if you told me that I had breast cancer, you'd go in there and you would take the lump out. If you're telling me I have ovarian cancer, I want my ovaries out. And so finally, I went to the 3rd surgeon, which was Dr. Fader, who is from the Kelly Group. And she said, Rosie, if I were your mother, your sister, you know, I would tell you to go ahead and have the surgery. We did. Afterwards, I then went on to get genetic counseling. My doctor, I get my chemo at GBMC. And so my doctor there suggested that I go for genetic counseling. When I did, I found out that I was BRCA1 positive. Which kind of answered my questions that I was talking about with my grandmother and my mother. That made me realize that it was true. I mean, it wasn't something I was just thinking all these years. It was real.
And how long ago was this?
This is, I was diagnosed in September. It'll be 4 years.
Okay, so you've been treating it for 4 years after surgery.
After surgery, yes. And I am stage 4. So I am blessed to be alive. Right, and it's only, like you were saying, all the new technology and everything. I feel like every day that I live is a day closer to things that they find that will keep me alive longer. The sad part of my story is I was diagnosed with the BRCA1 gene. I have a daughter. My daughter went for testing, found out that she was BRCA1 positive, the same as myself. She went in for what was supposed to have been a prophylactic hysterectomy. And when they got in there, the surgeon came down to my son-in-law and I and said, I don't know how to tell you this, but she already has cancer.
Wow.
So she was stage 2.
Yeah.
And I swore at that moment that I had saved the most precious life in the world to me, which was my own daughter, and that the world was out there waiting for me, and I wanted to save anybody and everybody that I could. And so anyone who will listen to me, I'll talk to them. People, I wear teal nail polish, and wherever I go, people stop me and say, oh, your nail polish is really pretty, and that's my perfect introduction.
To tell them
my story briefly.
Let me ask you, I mean, her symptoms, original symptoms, she had, was a pain walking.
So
No.
this is really typical that women with ovarian cancer it typically takes about 3 to 4 months actually to come up with a diagnosis because the symptoms are so vague. And so sometimes women will get told that they're hysterical or that they have a irritable bowel or something like that. And ultimately the diagnosis is made, but it is actually sometimes can be a very difficult diagnosis to make.
Is it also difficult to make that decision about she wanted the surgery versus chemo? Is that
So almost all
because she followed through on her own?
Well,
She just kept going until she got what she needed.
almost all women with ovarian cancer should be treated with a combination of chemotherapy and surgery.
Right.
And unfortunately, when you look at patterns of care in this country, that is not always the case. And there's a substantial number of women who are not receiving both. But both methods of treatment are absolutely essential for treatment for this disease.
And you are now getting your regular to go and you
Well,
get.
I'm on a maintenance drug right now called Avastin, which basically stops the blood supply to cancer cells, and it has kept me at status quo. I'm not cancer-free.
Right.
I'm not in remission. You know, my oncologist says I'm status quo. I've been on this drug since February a year ago, and so far it's been doing its trick.
And what does that mean? Status quo.
Well, some of our newer targeted chemotherapies don't have the goal of cancer killing per se, but have the goal of keeping the cancer from growing. And so the Avastin or bevacizumab is one of those drugs that doesn't necessarily kill the cancer cells directly, but keeps the cancer cells from recruiting new blood cells so they can't grow.
And your daughter? Is she
My
getting-
daughter is doing wonderful.
That's terrific.
And she and I do everything we possibly can. She lives in Virginia. She does a lot to speak to people, to mentor younger women. Okay, where I can speak to an older crowd. She talks to young women in their 40s who go, how do I tell my children I have cancer? How do I explain to them I'm not going to feel good? That all these kinds of things. So we as a mother-daughter team, we've got it all covered.
You got it all covered.
We
I was
do.
gonna
We
say.
do, unfortunately, but
your
we've committed ourselves to this.
Roz, your message to women out there is to get tested, see your doctor.
Well, I have two, if I'm allowed to say this. One is that I think part of my not anger, but my feelings are, we go to all these doctors and you have to fill out all these forms showing what your family history is. My family history is terrible. Okay, that was what I told you was about my mother. My dad died of cancer, his sister died of cancer, and I have a brother who has cancer. So why didn't someone, before this all happened, say to me, you're the perfect candidate to go for genetic counseling? Right. So why did I fill out all these forms and nobody say anything?
Well,
so I feel that's important
You know what?
to talk to their doctors about
It's
that.
an amazing message, and I thank you so much for sharing your story, Dr. Temkin, the great work that Hopkins is doing. We're putting the word out there. We've got websites. Hopefully people will take advantage. So thank both of you. Thank you so much.
Oh, my
and good
pleasure,
luck to
believe
you.
me. Thank you.
And Doctor, thank you for
Thanks.
being with us.
Thank you.
When we come back to Straight Talk, we're going to talk about another problem in our community, and it's about HIV and treatments. So stay with us. We're coming right back to Straight Talk.
Your daughter just had her first breakup. Do you A, put yourself in her shoes? B, console her?
Don't worry, sweetie. This is gonna happen a lot.
Or C, find her a new boyfriend?
Nice, single boys. That was weird.
As a parent, there are no perfect answers. But you don't have to be perfect to be a perfect parent. Thousands of teens in foster care will love you just the same.
It's a short ride from your neighborhood to your naturehood. Find fun activities to do, like boating and biking, or camping and hiking, plus much more. To find a neighborhood park or green space near you, visit discovertheforest.org. Don't allow your weight to threaten your health or control your future. Excess weight or obesity can cause emotional and physical health risks. But you can take control. The Your Weight Matters campaign offers free resources and tips to help you measure and understand your weight. Take the Your Weight Matters Challenge. The free toolkit prepares you to speak with a healthcare provider about your weight. Your weight does matter. Take the challenge and take control today.
Straight Talk. We're talking about a lot of different health issues in our community, and one that we all certainly are well aware of is the problem of HIV and AIDS. And joining me now is an amazing resource in Baltimore, the Chase Braxton Center. I mean, it's just, they do amazing work and have for many years. And we're going to hear about that and some other things with Jill Crank, who, you have such a big title here. Oh. Assistant Medical Director, Chase Braxton Care at the Mount Vernon Center. Yes. Is that right?
Yes, sir.
Okay, good. And Cedric Gum, right, who's a peer navigator at Chase Braxton. So welcome.
Thank you.
Both of you. Yeah. Jill, get us started. You know, we hear about HIV, we hear about AIDS, and I think sometimes it's on the front burner, sometimes it's on the back burner. Give us a little update on how we stand here.
Sure. So awareness of the HIV epidemic has decreased recently because it's not as serious as it was in the 80s or 90s. Right. We have amazing medications that can treat HIV pretty easily, and so people have forgotten about it. However, it remains the 4th leading cause of death in Baltimore City, when it's not even on the top 10 for the state or the nation.
So obviously Baltimore is
very much affected.
Has a huge problem. Yes. And I would imagine because of the drug issue and needle sharing is probably one of the bigger issues. Baltimore does have a big heroin problem. Yes. So is that what you see at this point?
So sure. The leading cause of transmission for the HIV virus is actually through sexual activity, but it is still also very effectively transmitted through blood. So sharing needles for injection drug use is a potential transmission route. There are needle exchange vans in Baltimore City, and a recent law was just passed to expand that to many other health centers throughout the state, which is very exciting.
So what other reasons is Baltimore has such a higher rate?
So I think, Cedric and I were talking about this. I think stigma is still very much a part of HIV. People are afraid to get tested, talk about their condition if they have it. And the other part too is we're not doing enough testing. Even medical providers and offices who have the patients in front of them are not doing HIV testing in the way that they should.
And so with the patients coming in, just regular treatment, like the HIV test has to be something special almost, like it's not a normal blood test that's done?
Well, actually, it's pretty easy. So the CDC has recommended that everyone above age 13 to 64 should have one HIV test in their lifetime. And it is, there are rapid tests that are finger stick or oral swab with results in less than 15 minutes. Or it can be put right into your cholesterol testing lab order, and you'll get a result in a few days.
And then I guess the whole issue of safe sex.
Yep.
You know, if we're talking through sexual activity or through drugs, and we've got to deal with needles, and we got to deal with unprotected sex.
Yes.
And I guess Baltimore's way up there on both.
Definitely, definitely. But we have actually a great program that's gaining a lot of momentum for prevention, and I'll let Cedric talk to that.
Yeah. So the Power Project, which is a community outreach and engagement program at Chase Braxton, it focuses on prevention and treatment, which the primary focus is prevention. We have PrEP, which is pre-exposure prophylaxis, and we also have PEP, which is post-exposure prophylaxis, which are very great prevention strategies that have been introduced. We also have HIV testing. We have couples testing and counseling. We also do case management and do a lot of community outreach and engagement activities in the community. And coming soon, we have our mobile van, which will be going out into the community to be able to reach those individuals who don't have access to get to us for testing. And just giving out incentives and spreading the word about PrEP and PEP and the services that we offer specifically is definitely important to making sure the community is aware that it's still something that needs to be discussed and still something that they need to be proactive about.
Now, Baltimore has a very big, faith community, which I'm sure you guys tap into often to reach, because to get that message out. When you say you're going out, are you going to the churches, the schools? Where do you go the most to get your message out?
The most recent, we do a lot of health fairs at schools and colleges around Baltimore. We do like community, like block party type events. We go to, we recently partnered with a theater company where we go there once a month to do like outreach and tabling there, just to make sure that we spread as much knowledge about the services that we offer, and also to let people know that there are other preventative measures outside of just using condoms, which is definitely important. But want to let them know that there are other methods to protect themselves if they are engaging in unprotected sex, or if they are sharing needles and things of that nature.
Because I totally agree about the stigma part of this whole thing, that, it's, and the fact that, as you say, we've got new medicines, you don't hear about it as much, and things tend to drop off in this country if we don't keep it on the front burner.
Exactly.
Somebody comes in and they are HIV positive. What do you do for them?
We provide a very safe place for them to receive care. We teach them about their illness, tell them how we're going to get them on medication. There are 6 regimens now that are 1 pill a day, which is a tremendous advance compared to 30 years ago, 25 years ago. And then we basically treat them as a whole person. We do their primary care, their GYN care, addictions, behavioral health, pharmacy and lab.
Treat the whole piece of it. Okay, Chase Braxton. We've got the website. I can't thank you guys enough. It's such a big issue. I'm hoping people will, realize it affects a lot of people. We have a drug epidemic again, which is only going to spread it even further. So thank you all for the work that you do. Thanks for being here.
Thank you.
Great. Today on Straight Talk, we're talking about a lot of different health issues. I want to thank all of our guests. I want to thank you for watching, and we'll see you next time on Straight Talk.
Days like this are getting harder to find. We're long on life, but short on time. When I get a chance to kick back and unwind, I live for Myrtle Beach days. Myrtle Beach days got blue in the sky, not a care in the air, ocean breeze blowing by, just sitting on the sand, soaking up the sunshine. I live for Myrtle Beach days.
Hyundai's full line of cars and SUVs at your local Hyundai dealer aren't just new, they're better.
The Big 33 High School Football All-Star Game. Maryland takes on Pennsylvania. Brought to you by your local Toyota dealers and by Morgan State University.
The Big 33 Football Classic, Saturday, June 18th at 7, here on the CW Baltimore.
WUTB recruits organizations that regularly distribute information about employment opportunities. To include your organization on our referral list, please contact the station.
They caused chaos and global wars, resulting in a lost opportunity for a determined man. This week on Ring of Honor Wrestling, Colt Cabana gets his shot at the Bullet Club when he takes on Adam Page.
Today at 1 on MyTV Baltimore.
Spend 15 minutes watching online videos like this one.
Brushing for 2 minutes now can save your child from severe tooth pain later. 2 minutes, twice a day. They have the time.
On the next Two Broke Girls, Caroline goes coupon crazy.
Who doesn't like free money? I don't know about free money, but this is like watching someone free base for the first time.
And you better not get between her and a deal.
Oh, hell